In the past few months, South Africa, which accounts for over a third of total COVID-19 infections and 40% of deaths related to the disease on the continent, had seen a severe third wave of infections over the past month spurred by the Delta variant, but that has recently been waning. As a result, South Africa has lifted off some of the restrictions that have been put in place to curb the spread of COVID-19 in the country.
Now, in Kenya, on the other hand, with our fourth wave, the numbers are continuing to go down, but our positivity rate is still high. It's still above 5%. And although we are talking about a comparison of maybe 500, 600 cases compared to maybe 1,000, but we are still not quite there yet. So I think the lessons that we'll have to pick from South Africa is, although they too have not vaccinated more than 10-15% of their population, I think for our country, if we hit below 5%, and if the numbers actually go down below 500 cases a day at the same number of testing being done, then perhaps we might be able to say the government can start looking at easing the restrictions.
A rise in the number of people who tested positive for COVID-19 meant here was a passive immunity that likely has played a key role in reducing the surge of COVID cases in the country. The vaccination drive too played a role in ring-fencing the prevention of the chain of infection at the community level.
I think there's a lot of data which is showing that in many of these African countries, including in Kenya, in South Africa, more than 60% of households have actually been exposed to COVID, which means we have some level of immunity that was not there compared to the first and the second wave.
For Kenya to achieve similar herd immunity, it will either be through more people being infected or more getting vaccinated, and to ascertain that, it will be done through antibody tests.
Previous infection does confer immunity. And if you have more than 70% of the population having immunity because of previous infection, that can be termed as herd immunity. However, with COVID, things have really changed, particularly due to the Delta variant. And now we are hearing about this new variant. Now, what is being shown is that these variants can actually cause reinfection.
So far, Kenya has recorded a decline in the number of people testing positive for coronavirus. And despite vaccine apathy, many more Kenyans have been turning up for the vaccine drive aimed at vaccinating 10% of the population by the end of the year.
When people are having immunity, whether it's because of past infection or because of vaccination, it means that the virus is not going to spread rapidly in a community when there is a surge. In other words, the surge will not be quite rapid and quite high because the number of people who are infected previously and have immunity, or the number of people who have been vaccinated, they break the chain of transmission. Think about it like I've said before. Think about it like a wildfire. If you have a dry bush, the wildfire will spread much faster than when you have, green trees, wet trees. So the more number of trees that can resist the fire, the less likely the fire will spread quite fast and quite rapidly to overwhelm the firefighters.
Going by the World Health Organization standards, if Kenya were to sustain a positivity rate of 5% and below consistently for at least 2 weeks, this could translate to further easing of restrictions owing to increased herd immunity. Eunice Omolo, NTV, Nairobi.